Hi there, my name is Zach Woods. I'm the clinic manager and physical therapist down in Therapy Excellence Burleson. I wanted to talk to you a little bit today about balance. Now, a lot of people are asking, well, balance is this ethereal concept, but really it's three of your systems all working together to paint a picture to your brain as to where your body is in space and how to correct it. So, the three systems that we note in balance are the eyes, so the visual system. You have your inner ears, which would be your vestibular system, and you hear about people getting vertigo when they go on roller coasters or rolling over in bed and the room starts spinning. That's your vestibular system. And then you also have what's called proprioception. Those are pressure sensors in all of your joints that then again communicate to the brain and say, hey, we're actually shifting more of our weight over onto our right leg. We need to move back to the center. Now, all three of those systems have to work together in order to keep you upright. So, if you're having trouble with any of those, what we need to do is we need to train the rest of the systems. So I'm going to take you through a simple progression that I take some of my patients through to kind of identify where some of those barriers are. So what I'll first have people do, we'll go from easy to hard. A lot of the time when I do this, if you're at home by yourself, you'll want to be in a secure place where in case you lose your balance, you're nice and secure. So get into a corner here to where if you go right, you're into the wall, left, you're into the wall, and then you can also pull a chair right in front of you. Now for the sake of this, so that you can see what I'm doing, I'm going to move the chair out of the way. So what you can do is stand putting your feet all the way together. You can stand here, cross your arms over your chest, and try and hold this here for about 30 seconds or so, and see if you can be successful. If that feels really easy, then what you can do is close your eyes. Now we're taking away that visual system and working the vestibular system and the joint receptors, so proprioception. So if we close our eyes, we try and hold for about 30 seconds. If you're successful with that, then you can just change up your base of support down here. So then you can try and put one foot all the way in front of the other, kind of like you're walking on a tightrope. Same thing, eyes open, cross your arms over your chest, try and hold it 30 seconds. If that still feels really easy, switch to the other side and see if you're equally as good. Then, if that's still easy, you can go ahead and close your eyes. You might feel yourself shifting side to side a little bit more, but remember that you're only using 2 out of your 3 systems when you're closing your eyes. So of course it's going to be a little bit harder. If that still feels really easy, go all the way into single leg standing. Eyes open, arms across your chest. Try and hold it for 10, 15, 30 seconds. Challenge yourself, see how much you can do. Switch to the other side. And see how you do with that. If all of that is still easy, what we can do is we can start messing with your joint sensors. So we put a cushion down. This here is the foam that we use in the clinic. You can grab yourself a throw cushion or a pillow, and you can put that down here as well. And then you can start all over again. Eyes open, feet together. Eyes closed, feet together. One foot in front of the other with your eyes open. One foot in front of the other with your eyes closed. Then you can go to single leg. See, a little wobbly there. And then you can go single leg with your eyes closed. Again, you want to make sure that you're nice and secure in case you lose your balance. So that's where that chair will come into play. So these balance exercises are really fun because you can always challenge yourself. You can put a timer and see, hey, can I make it to 30 seconds today? Can I make it to a full minute today? But identify where your impairments are. So where are you having trouble? Is it eyes closed? Is it with the foam surface? And you can really try and practice and get better. So thank you again. If you're still having balance deficits or having trouble with falls or feeling unstable on your feet, you can always come in to talk to one of our licensed physical therapists and we can get you an evaluation and really work with you on trying to achieve your goals.